Well, the majority of patients with Friedreich's ataxia are not aware of any particular problems with their sight, right. But some are. And there is a spectrum, there's a range. So from patients who are not aware of any problem at all, and that's many patients with Friedreich's, to patients who have profound visual loss and are almost blind, and everything in between. The visual, it's easier to think about the symptoms in terms of the different parts of the visual system that are affected. So in Friedreich's, first of all, Friedreich's does not cause any problem in the eye. But Friedreich's is associated with problems with the visual system and with the motor system. The visual system being the cabling that connects the camera to the computer, and the motor system being the system that moves the eyes around. So with the visual system, the part of the visual system that is most susceptible to damage in Friedreich's is the optic nerves, the cables behind the eye. And patients whose optic nerves are damaged will progressively find their vision is less clear over time. It usually comes on very gradually and progresses very, very slowly over decades. But there are just occasional rare cases of patients where the visual loss is much more dramatic. It may occur over just a few days. But these are the exceptions. Regarding the motor system, so that is the ability to point the camera in the right direction, for both cameras to be aligned with each other and to be able to move those cameras around to look at different things. Well, the symptoms that are associated with the motor problems include oscillopsia, so this is wobble of the vision, so the visual scene seems to shake. It includes double vision and just a hard to express but general difficulty with navigating your eyes around, for example, a block of text when you're trying to read. That would be an example of a task which Friedreich's patients often find difficult. Nystagmus is an involuntary movement of the eyes, and all patients with Friedreich's ataxia have some degree of nystagmus. Generally speaking, the nystagmus is not there when they look straight ahead. It is only evident if they look to the extreme right or left or up or down. And so most patients with Friedreich's do not have visual symptoms associated with their nystagmus. As time goes by and their Friedreich's gets worse, their nystagmus will also progress. But in my experience, even patients who are very disabled by Friedreich's and are very ataxic still don't have nystagmus that causes them much in the way of visual problem. What is more troublesome to patients is their involuntary head movements. So in a healthy person, when the tripod moves, the camera stays still and the image stays clear because our vestibular apparatus compensates for those head movements. But in a patient with Friedreich's, their ataxia means they have involuntary head movements. In other words, the tripod is moving, but the vestibular apparatus is also not working properly in Friedreich's. So when the head involuntarily moves, the camera shakes and then they don't get a good image. So it is in fact the involuntary head movements and the poor vestibular function that is a problem for patients with Friedreich's rather than the nystagmus. So if we take the visual system, only about 20% of patients with Friedreich's, in my experience, are aware of the damage to their visual system. About 50% of those patients have damage that we can detect by looking in the eye. And if we use special techniques, we're able to detect damage in almost everyone with Friedreich's. And the same principle applies to the motor system. That is that almost everybody with Friedreich's has abnormal eye movements, but only a small proportion of those patients are aware of of symptoms associated with those abnormalities. Well, I should say that I only see adults because in this hospital we don't see anybody under the age of 18. But most of my symptomatic patients with Friedreich's become symptomatic later on in the disease. In other words, it's not there at the beginning. For example, I can't really think of anybody who's run into a lot of trouble in their 20s. It would usually be patients who are older than that. So the older you are, and the longer that you have had your Friedreich's, that is since the onset of the disease, the more likely you are to run into trouble. So this is usually these problems arise late in the disease. Well, first of all, there are tests of function, that is how well a patient can see and how well they can move their eyes around. So the kind of tests that we routinely would do are visual acuity, which is your ability to see the fine detail straight ahead. So the letters, for example, on the chart behind me, that would be visual acuity. That's the sort of thing that would be done routinely, for example, by an optician. In addition, and probably more relevant to the majority of patients with Friedreich's, we can check the peripheral vision. So we call that the visual field test, and that's to test how well patients can see around the outside as opposed to straight ahead. Peripheral vision testing is time-consuming, quite demanding, quite laborious, exhausting for the patients. Technically not very easy to do in patients who are disabled or in wheelchairs. So we'll come back to that in a moment as to whether that is helpful. It does give us information, but is it helpful to the patient? We'll come back to that in a moment. Then there are electrical tests that can be done of function. These are tests where lights are flashed in the eyes and then electrodes are used to record the electrical responses from the eye or from the brain to see how well the visual apparatus is working in response to those stimuli. These kind of tests are very sophisticated. They require equipment which is not available everywhere, and they would really fall more into the research domain. And then finally there are tests of structure. So what I mean by that is we can use imaging techniques to look very precisely at the back of the eye to look at the nerve fibre layer, which is the nerve fibres that go down the optic nerve. We can look at the thickness of that nerve fibre layer to see whether that is normal or abnormal and whether it's changing over time. That gives us an indication of the front of the visual system, the optic nerves. We can also image the back of the visual system by doing MRI scans of the brain. So there's a variety of tests, and you can see that some of them are very straightforward and simple and could be done in an optician. Some of them are more sophisticated, more expensive, more demanding, and need to be done in a hospital or even in a research setting. So to come back to your question about which tests are relevant, it depends on what you're trying to achieve with the tests. If you are trying to answer the question, is there a problem or not, then simply asking the patient and then doing targeted function testing is sufficient to answer that question. If the question is my vision changing over time, is it getting worse, for example, year on year, then that is a question that also can be answered clinically with fairly low tech equipment, but needs serial measurements and is a bit more laborious, and patients may well wonder what is the point of that. Some patients want to know, but for some patients, if there isn't a cure, if there isn't an intervention that will help, then they can't see the point of doing this. And then finally, there are those tests I alluded to, which are very high-tech and are research type of tests, they would not routinely be done on Friedreich's patients unless it was part of a research study. So those are tests that we are increasingly interested in because they may give us information that we can use to determine whether interventions, drugs for example, are helping to treat Friedreich's. So we're very interested in applying these specialist techniques for clinical trials. So this is a very exciting area for us, but it hasn't yet been worked out as to what measurements we should take and how useful they might be in deciding what treatments might help with Friedreich's. Unfortunately, we don't know the answer to that question. We would really like to know the answer, and I know a lot of my patients do take supplements in the hope that it might be helpful. We need the data, we need the clinical trials to answer that question. In general, most of these supplements are not harmful, or at least the risk of harm is very low. So as long as patients are following the instructions on the packet, and as long as they make sure that their family practitioners or their ataxia clinicians are aware of what they're taking, then it is unlikely they will come to any harm. But I don't know of any studies that have been done that help to answer that question. And really this is the thing that we need to move towards, is to do those clinical trials to answer this question about what can be done to slow down the progression of this disease. The question of exercise, that is to use muscles in order to try to sustain their function or improve their function, is often asked by my patients to me, not just patients with Friedreich's, but any patients with oculomotor problems. They ask if there's something they can do by moving their eyes around in much the same way as physiotherapy can help with limb muscles. They wonder if exercises of the eye muscles can help. It turns out that the eye muscles are rather different from muscles elsewhere in the body. They are used all the time, whether we actively exercise them or not. So in fact exercises I think are not helpful. There is just one small group of Friedreich's patients, just one area of oculomotor problem where it might be helpful, and that is that some patients have a difficulty when they're looking at things close up to converge their eyes. So weakness of convergence is about the only oculomotor problem that can be improved with exercise. But it also needs to be said that most ataxic patients, both Friedreich's and other types of ataxia, have a tendency for their eyes to come in anyway. So in fact, convergence weakness is relatively rare in Friedreich's. So the broad answer to your question is no, I don't think eye movement exercises are helpful in Friedreich's. I do. I think that it's a very exciting technology, and I hope that one day we can treat optic atrophy, that is the loss of nerve fibres in the optic nerves, with stem cells to regrow new optic nerve fibres. I think it's very exciting, and it is the technology that we are all hoping will be beneficial. The current status is that this is not technically possible. We are doing research using stem cells to regrow some of the cells in the retina and in the layer under the retina in the eye. So we are already developing the technology in that very particular situation. And really we have to solve those problems first. And if we can then overcome those barriers, we can move on to the optic nerve, which is technically a bigger challenge. But I think eventually I am hopeful that this will be possible.